Hi everyone, welcome back to my YouTube channel, and today we are going to talk about tongue movement and hypoglossal nerve injury. So let's start topic with introduction. Tongue is highly mobile muscular organ essential for speech, mastication, swallowing and taste. Its movements are produced by coordinated action of intrinsic and extrinsic muscles which are mainly supplied by hypoglossal nerve, that is 12th cranial nerve. Injury to this nerve lead to characteristic motor deficits of the tongue. Muscles involved in tongue movement. They are intrinsic muscles and extrinsic muscles. Intrinsic muscles of tongue. Intrinsic muscles are located entirely within the tongue and are responsible for changing its shape. These muscles help in shortening and elongating the tongue, curling the tip upward or downward, and flattening or narrowing the tongue. Then there are extrinsic muscles that originate outside the tongue and are responsible for changing its position. There are genioglossus muscles that protrude the tongue and prevent it from falling back. There is hypoglossous muscle that depresses the tongue. Styloglossus muscle that retract and elevates the tongue. And palatoglossus muscle that elevate the posterior part of the tongue. Nerve supply for tongue muscle. All intrinsic and extrinsic muscles of nerve are supplied by hypoglossal nerve, that is 12th cranial nerve. Palatoglossal muscle is exemption and is supplied by vagus nerve, that is 10th cranial nerve, through the pharyngeal plexus. Mechanism of tongue movement. First is protrusion of tongue. Protrusion is mainly produced by genioglossus muscle. When both genioglossus muscles contract together, the tongue protrudes straight forward. Second is retraction of the tongue. Retraction is achieved by styloglossus muscle assisted by intrinsic muscles. Third is elevation of the tongue. Elevation is produced by styloglossus and palatoglossus muscle along with intrinsic muscles. Fourth is depression of the tongue. Depression of tongue is carried out by hypoglossal muscles. Causes of hypoglossal injury. The hypoglossal injury may occur due to trauma to the neck or base of the skull. It may occur due to tumors involving the hypoglossal canal, because of stroke, surgical procedure that occur in the neck region, and because of infections. Effects of hypoglossal nerve injury. Injury to hypoglossal nerve result in paralysis of tongue muscles on the affected side. It can cause difficulty in speech, that is also called as dysarthria. It can cause difficulty in swallowing, that is also called as dysphagia, and muscle wasting, that is also called as atrophy. Fasciculations of tongue are also caused by hypoglossal nerve injury. 6 is deviation of the tongue. It is when the tongue is protruded, it deviates towards the side of lesion. This occurs because the normal genioglossus muscle pushes the tongue forward unopposed while the paralyzed side fails to act. Upper versus lower motor neuron lesions. First is upper motor neuron lesion. In this case, tongue deviates away from the side of lesion. No muscle atrophy is there and minimal weakness due to bilateral cortical intervention. Then there is lower motor neuron lesion of hypoglossal nerve. In this, there is tongue deviate towards the side of lesion. Muscle atrophy is there and fasciculations are present, and also there is severe weakness associated. Clinical examination include assessment, that includes asking the patient to protrude the tongue, observing deviation, wasting or fasciculation, assessing speech clarity, and checking tongue movement side to side. Clinical importance. Knowledge of tongue movement and hypoglossal nerve energy is essential in neurological examination, in diagnosis of brain stimulation, in head and neck surgeries, and in stroke evaluation. Conclusion of this lecture video. Hypoglossal nerve play a vital role in tongue movement by supplying almost all tongue muscles. Injury to this nerve lead to characteristic deviation, weakness, and atrophy of the tongue. Understanding these features is important for accurate clinical diagnosis and management. And this was about hypoglossal nerve and tongue movement, injury and tongue movement. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.